And it's time to bust some medical mysteries. And our twin doctors, Dr. I and Dr. J, are back this morning to answer those trending health questions. Hey, guys, I hear you're having a birthday, too, and you're celebrating in Portugal. Is that right?
Yep. I'm in Lisbon right now, and Idris is flying out later on tonight.
Well, thanks for
Happy
spending your birthday with us. Yes, we'll have to build you a cake or something. Also, while you're there, you need to go to Sintra, which is it is like almost like you'll feel like you're in Disneyland with castles while you're in Portugal, while you're in Lisbon. Anyway, look it up. I'm telling you. Okay, so let's play the true or false game. I've been looking forward so much to seeing you guys today. So if you are using aspirin regularly and getting a colonoscopy is not mandatory, I'm going to say false. Dr. I, you can answer.
That is correct. It is false. It is false. So when you're getting your colonoscopy or the fecal occult blood testing or any number of screening tools, we're looking for colon cancer, right? Colon cancer starts from polyps, which are benign growths, but then can progress. And so for years, we've known that aspirin can reduce the risk of colorectal cancer, but the recommendation to use aspirin regularly was rescinded a few years ago because of the risk of bleeding. What we have found, though, outside of heredity, certain lifestyle factors, so obesity, being sedentary, being diabetic, hypertensive, eating processed foods, alcohol, smoking, all of these can increase your risk of colon cancer. In these people, aspirin is recommended because it greatly reduces your risk of colon cancer. So talk to your doctor, but aspirin can reduce your risk, but you still got to get the colonoscopy.
Okay, good deal. Dr. J, I'll let you answer this one. True or false? Getting the shingles vaccine can protect you against developing dementia later in life. I'm going to guess true, just as a guess.
As I get older, I'm fearing dementia more, especially as I see my brother go downhill. So I'm happy to say that this is true. This is true. So people are probably thinking, well, what's the link between a vaccine that protects against rashes and preventing dementia? But it kind of makes sense when you think about the fact that the shingles virus is in the herpes family of viruses. And herpes viruses are weak viruses. They're not very strong. And so after they give us that initial painful, unsightly rash, they tend to hide in our bodies. And they hide in nerves. Our brain, amazing organ, but it's basically just a collection of nerves. And so portions of the virus hide in our brain. When it reactivates, because our immune system's compromised, that reactivation process damages the nerves that it's in. If the shingles virus has been hiding in your brain, it can damage parts of the brain that ultimately can lead to cognitive decline. And so research has shown that women who get the shingles virus or vaccine decrease their risk of dementia by upwards of 25%, men about 15%. So it's actually a pretty simple thing you can do.
Yeah, so get that shingles vaccine. Okay,
100%.
Dr. I'll give you this one. True or false? Swallowing your gum can lead to serious health consequences. I'm going to say maybe if it's a lot of gum, it can. True?
You're on it today. You're on it. So the answer we usually tell people is no. It is not going to cause any problems. We call it chewing gum for a reason. Chew it, not swallow it. But for the most part, if you swallow your gum, it's just going to pass right on through your GI tract and make a reappearance in about 2 to 3 days. However, usually in kids, and these are kids that have issues with like constipation, intestinal issues, if you swallow too much gum, it can actually cause a blockage. So for the most part, you're fine to swallow it, just not too much. But for certain people, it can be harmful.
Okay, I do not let my 5-year-old have gum, and he's like, Mom, so little Johnny gets to. Okay, true or false? Applying sugar to your scalp can reverse balding. I'm going to say no way. False.
It's morning in America, and a lot of men are reaching for the sugar right now because this is actually true.
No
This
way.
is true. But it's not common table sugar. It's not glucose. It's a particular type of sugar called deoxyribose. Now, what's really cool is deoxyribose is the deoxyribonucleic acid in DNA. So basically, all living things have the sugar in their body already. And research has shown that when you put the sugar in a gel form, you apply it to the scalp, it increases blood flow to hair follicles. Hair loss is basically caused by decreased blood flow to follicles and changes in how our body responds to certain forms of testosterone. And so actually, yes, this sugar gel has been found to be as effective as finasteride and minoxidil, which are FDA approved at both reversing hair loss and promoting hair growth. So it's actually
So
true.
not table sugar like people are putting in their coffee, but it's deoxyribose. Did I say that right?
Deoxyribose.
Okay,
100%.
deoxyribose. You got to cross your eyes like that to make it come out properly. 10 minutes before the top of the hour. Happy birthday, you guys. Thank you so much. Enjoy Portugal and go to Sintra. Friends at home, if you have a medical or health question that you'd like to see answered on our show, Dr. I and Dr. J, you can also find them on social media as well. They are at the Twin Doctors _. So check them out there too.